5 Steps project was about patient experience and coming into the clinic and what their first experiences were and what we could improve within our podiatry environment. So what we did is use the local link support groups to get some patients to come and view our clinics with other members of staff and see how we could improve the clinic. So it was looking at lots of different areas. So if the environment was safe, if it was organised, if the reception area was welcoming. So we picked 4 clinics within the Cambridgeshire area to go round with those patients, and we all looked within sort of half an hour at whatever we saw within those clinics. We then took the feedback and then tried to improve them.
The things that we were looking at was what we could hear, what we could smell, what we could feel, what we could touch to make the rooms more welcoming. We were looking at how safe the environment was, whether the floor was okay, whether the couches were okay, whether there was equipment in the way that needed to be moved. We looked at how the podiatrist interacted with the patients and whether they were given feedback, whether there was information that was on display that was relevant and up to date. We looked at how tidy the rooms were, and whether there was labels on the cupboards and things like that. So those areas were identified that needed improvement in certain locations. So we took that all back then to our staff meeting, full staff meeting, shared that all with the team. The team then were given areas of responsibility to make these improvements, with a clinician to have overall responsibility to ensure that action happened.
So a lot of the feedback we had was around, first of all, the reception areas, so making them more welcoming. So we made sure we'd have posters with the podiatry logos, telephone numbers. One of the clinics we visited had lots of clutter and lots of out-of-date posters in the reception area, so we got all of them down. We've had really good feedback from the patients that clinic is much improved now.